Hello and good afternoon. My name is Kevin Rockwell with Kevin Rockwell Marketing, and I'm here today with Carl Shames, who is a neurofeedback therapist in the San Francisco Bay Area, with offices in Marin and in the East Bay as well in Albany. Uh, Today, I'd like to introduce you to Carl and have him talk about the benefits of neurofeedback therapy and what this actually means for a lot of folks suffering from various issues. So, Carl, welcome today, and please tell folks a little bit about your background and what you're doing.
Thank you. I'm glad to have this opportunity. Neurofeedback is an amazing new modality. It's developed over the last, I'd say, well, 10 to 15 years and really become more effective and efficient in, say, the last 5 years. So at this point, it's more available and more realistic for people to choose it as an option. Neurofeedback actually changes brainwave patterns. It retrains the brain. And many of the difficulties that people experience, such as anxiety, panic attacks, inability to concentrate, both adults and children, sleep problems for sure, all have to do or have a component of brainwave problems. And in the past, there really was not much available. People would go to psychotherapy or take medication. But none of those other modalities really solved the problem of the brain not functioning properly. And neurofeedback actually retrains the brain. So neurofeedback is a very useful alternative to medications for many people suffering from anxiety, depression, PTSD, sleep problems, ADD, things like that.
Now, I would gather that there's a lot of people who don't even know or think that the brain can be trained. We tend to think of ourselves as stuck with all kinds of thoughts and feelings and pathways that we're going with our brain. But so maybe talk a little bit more about that. Is it when you say that a lot of people don't really understand this whole concept of retraining the brain?
Yeah, well, it's a new territory. I feel like I'm exploring, or I and other neurofeedback practitioners are exploring kind of a new continent or a new realm of human functioning that just hasn't been understood. And I have to say, even the medical people don't understand it properly. So, for instance, people might have trauma, they might have had a head injury, and the brain is not functioning properly. And up till now, there's been no real treatment for that. And so people are just really just kind of sent away from the clinics or sent to get psychiatric medications, which really that doesn't treat the problem. It just sort of covers it up and maybe like puts a Band-Aid on it. And then certainly, most people just don't have that idea. Really, the first issue that was recognized in this realm was ADD, and that's why it's called minimal brain dysfunction. And the idea, it was discovered that when kids were hyperactive and not paying attention, very often it wasn't from psychological causes. They'd go to psychotherapy, whatever. Originally, it was thought, well, they're acting out, which means that they have some psychological problem, and their behavior is an effect of the problem. But then it just became clear that that's just not true. It had to do with their brain and the way the brain was functioning or not functioning properly. So ADD, in the sort of mental health realm, ADD was really the first thing that was recognized as having to do with brain functioning. And ADD was one of the first, or really the first, issue that was approached or addressed with neurofeedback. Really, the very first one was seizure disorders. And but then after a while it became clear that really so many things and so many aspects of our functioning have that component of brain activity and problems of brain activity. So it's not whatever it is. For instance, let's say we have anxiety or we have depression. It's not solely in the realm of our psyche, in psychological causes, and it's not solely in the realm of biochemistry, neurochemistry. A lot of it is in the realm of the way the brain is the dynamics of the brain functioning. And we find out how much by doing the neurofeedback. And so very often cases of sleep problems, anxiety, panic attacks, nightmares, phobias, things like that, readily respond and just go away after a number of sessions of neurofeedback.
Carl, if you don't mind if I back up just a bit, you come from the world of traditional clinical psychology, so this isn't like you have a big history in this area. So maybe talk a little bit about that and what the transition to this means to you as a practitioner.
Well, yes, I have a whole lifetime career in mental health and in the world of clinical psychology. And up until recently, the primary modalities available for people with mental health issues were talking and medication. And then, a few other things developed, various types of expressive therapies, this and that. But really, that was about it. And I started feeling, it's really just very limited. And the medication, we've been taught to think of medication as a cure, so that we identify certain problems as diseases. So, for instance, in the medical indexes, they have lists of diseases, and then there's a whole section of mental health, and it lists these conditions as though they're diseases. So ADD, anxiety, and so on are listed as though these are diseases, and then people think, oh, there's a disease, so then there's a medication that cures the disease. So kind of like the same, it's all based on the model of that we learned, you have strep infection, and so you take the antibiotic, or when penicillin was invented. So that got rid of the infection, and that was the cure. So then you were all better, or you had pneumonia, you took antibiotics. So the medical people make us think as though it's the same thing, that you're taking an antidepressant and that's curing the depression, or you're taking an anti-anxiety and that's curing the anxiety. Well, it's really not. It's just kind of covering up or fudging the problem that the brain has. And very often, it does help significantly, but then people are stuck very dependent on these medications. And so millions and millions of people now are quite dependent on antidepressant medications, sleep medications, and anti-anxiety medications. And it hasn't really cured it. It's just sort of addressed it and helping people cope with these problems. Neurofeedback, I wouldn't exactly claim cures it either, but neurofeedback, unlike the medication, actually gets in there and shifts brain functioning. And that's what's so exciting about it to me, that it's a natural, holistic way of addressing these issues that's actually resolving problems that the brain has in the dynamics of its functioning that can lead to certain problems, and resolving it. So many people who've had sleep problems their whole lives, after a number of sessions, I just had somebody today said, I'm sleeping better than I ever remember sleeping. This is somebody in her 40s. And
that would be quite revolutionary for somebody who's suffered with that for a long time.
Yes. And people who've had anxiety their whole lives, who've had panic attacks, it just goes away. Because the cause of these problems was in these kind of brainwave patterns. How that came about is another question. Some people seem to be born with kind of revved up brains or depressed brains. Sometimes there are experiences, prenatal experiences, perinatal experiences. Some people have had injuries, head trauma. So there's any number of ways that the brain came to be dysfunctional. Or sometimes I think it's just the sort of experiences of life as we go through life and we get kind of dinged up like a car, various rents, dents and so on. The brain just sort of loses its ability to maintain the flexibility and the proper dynamics of its functioning. And so the neurofeedback, well, I think it's a methodology that's come along just in the nick of time as our world gets more and more complicated. The demands on our functioning are far greater than they were. I experienced it far greater than even in my life, say, 34 years ago, when there was no computers, there was no email. I got a few letters in the mail every week, and that was about it. life is so much more complicated now, and for kids, it's the demands are so much greater. So we need, we actually need socially developed techniques of straightening out the brain. So I feel neurofeedback's come along.
There's a fascinating concept because we could, we could end up being a whole society that needs this, not just folks who have suffered from these. We might be taking ourselves down a path where we all need to have our brain patterns realigned.
Well, I actually think I think of this as similar to Pilates, where a number of years ago the only people doing Pilates were dancers, and now everybody, or a great number of people, at least in some parts of the country and the world, recognize the need to stay in shape and take care of your body. And I'm quite sure that at some point in the not too distant future, the idea that we all need brain tune-ups will be kind of widely accepted. It'll just be sort of a normal part of life. Like, of course you need that.
Sure.
And I think in the past, people had that mostly through various spiritual practices. Even, say people, in the past, people went to church every day and chanted and so on. And I think, or there were rituals and ceremonies, and life was a lot less complicated. So there were less stresses on the brain and far more time spent straightening out what difficulties the brain might have had. And
Sure.
today we have a great deal more complexity, more stress, and practically no time at all spent to correct these things. So I'm sure, neurofeedback's come along just in time as a modern technology that can address all this. And so in that context, I want to mention it's really not just for people who have symptoms and disorders. Really, everybody can benefit. Everybody, or most people do it, come out feeling more what we used to call centered or balanced, just more able to take the sort of what life is throwing their way, whatever difficulties they have with a partner or a spouse, or if they're at their job.
For instance,
Almost universally, people find that they're more able to put up with things, and they feel more balanced in themselves, more able to express themselves, things like that.
This idea comes to mind when you say that. Take, for instance, somebody who, in their regular day-to-day existence, they're fine, but they get in a car and they find themselves raging at other drivers on the road. And that's the only time in their life that they're angry, or at least publicly angry. I mean, is that an example of somebody that could possibly retrain that behavior?
Sure, that's an interesting example, because on the one hand we could look at that psychologically and say, oh well, this person has built up anger, but we could also look at it, in terms of brain energy dynamics, that this person has to sort of blow off brain energy and doesn't have any other way of doing it, and the brain itself hasn't developed a way to release it. So in a way, you're looking at the same thing, but not from a psychological point of view, but from a sort of brain energy point of view. But the proof is in the pudding, because in my experience, that person, I've dealt with a number of people with anger management, not just road rage, but anger management, and neurofeedback is highly effective for that problem. It just straightens it right out, and people just will not do that anymore. So to me, that fact kind of shows what the theory is, that this person did not need 10 years of psychoanalysis or 2 years of cognitive behavioral therapy, whatever. They needed a few weeks of neurofeedback and just straightened out the brain, and that was the end of that.
Can you talk a little bit about there's a couple different ways to use the neurofeedback. Can you talk about the way you do it and possibly differentiating it from what else is out there?
Yeah, I'm glad you asked that. I find when people, it's great that people are discovering neurofeedback from searching on the web, and that's actually how I discovered it. And in the beginning, I was very skeptical, and also there's a tremendous amount of confusing information out there, contradictory and so on, and there's the usual people saying it's all a hoax and that don't waste your money, and tremendous amount of confusing information. And then even once you sort through all that, you find there are several different avenues of neurofeedback approaches or ways of doing it. And then it's hard to sort out, well, why is that, and which one is which. And so just to clarify that, I would say let's set aside the whole issue that it's a hoax, because that's ridiculous, and the people saying that have whatever motivations they have. The mainstream system does say, well, it's not scientific, it hasn't been proven, but of course their standards of proof are almost impossible to meet, and they like to say that so they can keep selling drugs. But within neurofeedback, once you've sort of sorted through all that, there's what I call the mainstream approach, which and the way it's traditionally developed, where measurements are made of the brain dynamics statistically. So you're measuring how much brain activity there is at a given spot at each frequency that's measured for brain waves. It's measured in hertz. So you're going from 1 hertz up to, let's say, 20 hertz. So at each of those brainwave frequencies, we want to see what's the level of activity for that frequency at that spot. So then you get what's called a brain map. And so the neurofeedback is designed to address abnormalities that are found in that brain map. So in other words, if at a certain spot the amount of beta waves is far above average, then we want to bring that down. Or if some other waves are under average, we want to bring that up. So the idea is to normalize the brain. And by now there's quite a bit of data, showing relationships between typical patterns and typical issues that people have. So I would call that the mainstream neurofeedback. The way I do it is different. It was developed by the Othmers, Siegfried and Susan Othmer, who have an institute in Southern California, the EEG Institute. And the Othmers are among the pioneers of the field, and they've sort of developed their own way to do it. And then I made certain modifications in the way they were doing it, which sort of led to a new direction altogether. And the way we do it is based on carefully observing how people respond to it, rather than on looking at the brainwave statistics. So we're not taking a brain map, we're not measuring brainwave patterns. We're giving the brain certain information based on what people come in and the issues that they present themselves with, and then we see how do people respond. And that starts to tell us what this brain wants. So I prefer this very much for several reasons. One, I think it's faster and more effective and more efficient. And two, it sort of lets each brain decide what it wants, rather than trying to normalize a brain and bring it into a statistically normal pattern. And we all know the example of, say, Albert Einstein, whose brain, God knows, was probably pretty out of whack in many ways, or Van Gogh. We have to respect a certain abnormality enough about brainwave patterns to really decide, is that the way to go, to just normalize things. On the other hand, with respect, I think that mainstream way of doing things, it is effective and it works. I just prefer the way that I do it.
Right. Well,
there are one or two other ways. Now there's a lot more. And I'm sure in the next few years there's going to be all kinds of stuff appearing. But those are the two within neurofeedback. Those are the two primary approaches.
And would you maybe just kind of give, I don't want to call it a laundry list, but sort of a listing of the different type of things that you help folks with, and maybe a little bit about success stories.
I would say the bulk of my practice does have to do with adults and children who have some combination of anxiety, problems with concentration, problems getting to sleep, problems calming themselves down, maybe little, kids who stutter, have twitches. Some cases of Tourette's, for instance, are amenable to neurofeedback. Headaches and migraines very often can be helped with neurofeedback. When I say things like very often, because I don't want to make promises that this field can't keep. And last thing I'd want to do is kind of overhype just how successful this is. It's very successful, but it's not a miracle either. So somebody with, say, migraines or depression, can be helped by neurofeedback, but we have to see just how much. But most people with, say, anxiety, certainly people with head injuries, post-concussion syndrome, this clears up most of the problem, or really all the problems that develop after concussions. People can't think straight, they lose certain abilities, they lose their balance, and the medical field really has up until now had no treatment for that. So neurofeedback clears that up.
Sounds like the NFL should be in touch with you.
Well, absolutely. Yes, I should write to them. Actually, I think little by little those people are discovering neurofeedback, but yeah, it's just not on the radar yet. For some reason, it's just not really understood. But absolutely. All those football players who have heads banged up, it's just so much more understood now than it used to be, that the brain isn't made to take this kind of beating. And so even pretty kind of mild concussions can lead to all kinds of symptoms, including anxiety and depression.
I grew up, my father worked in professional football as an athletic trainer. And, I knew, NFL teams have team doctors who are associated with them, but they tend to be orthopedists because football is a bone, bones are the big issue in football. And so you've got, a specialist in bones treating brain injury, brain concussions and whatnot. So it doesn't seem too far-fetched that professional sports teams should have their own neurofeedback therapist.
Well, that's a perfect example. That is just of the way that we're just so far behind in recognizing this issue of brain functioning. It's just not fully recognized. And aside from the athletes who could definitely be helped by it, like I said, you see people, in medical clinics every day suffering from concussions and head injuries, and neurofeedback is really the only treatment for that, and it's just not fully recognized yet. Speaking of athletes, neurofeedback also helps, like I said, not just for people who are symptomatic, but it improves and sharpens the functioning for everybody. So there are some athletes, and I think some Olympic teams, that have gotten wise to it because it just sharpens you up. And so your ability to focus, to go into hyper-focus, and then come out of it when you need to. So go in and out of states of focus. That's why the Air Force does use it in some cases. Golf players like to use it. But any performer or athlete can benefit from neurofeedback. It helps people be more at the top of their game, whatever their game may be. So if they're thinking as cloudy, or they need to be able to focus really fast and then relax really fast, neurofeedback really helps with that.
Well,
another area, like I said, anger management, and a type of person I get a number of times is, say, women with PMS. It's very helpful with that. Women who get very weepy, have all kinds of mood problems, get irritable. It's tremendously helpful for that issue.
Well, I used to coach youth sports teams, and I know that you can teach the skills, but teaching focus is actually one of the more important things. And it was so difficult at times to get the kids, especially teenagers, to understand this. But there would be these magical moments when you'd actually get a kid to understand finding focus and what it could mean for performance. And as you say, at the high levels, it is super critical, because you might be competing against somebody who has equal or better physical attributes than you, and the difference maker might just be the ability to be tuned to the performance.
Absolutely, yeah. The mental aspect of athletic performance is always very central, and so I'm sure there again that one of these days neurofeedback will be discovered, and people will, just everybody will want to use it, because it just tunes you up. Anybody experiences that. You feel more clarity, more focus, and just more able to function at the top of your game.
Well, Carl,
for myself, for instance, I used to have trouble I've kind of brain fog in the morning, kind of take a little while for my brain to get going. And then if I'm writing something, it might take me a little while to, think about what I need to write. And now and I'm not a young person anymore, my brain is sharp as can be the minute I wake up. And when I sit down to write something, it just comes right out. Don't have to mull over it a whole lot. Don't have to rewrite it a whole lot. I feel it's really changed my expressive abilities.
Very good.
So I've experienced it myself.
Well, Carl, thank you very much for joining us today. And can you tell folks where they can find you if they are interested in checking out your neurofeedback therapy?
Sure. I have two offices, one in Marin County in Corte Madera, and then another one in East Bay in Albany.
And your website?
Yeah, and then I have a website, brainbalancer.com.
All right. Thank you very much for joining us today, Carl.
Okay, you're very welcome. Thank you.